I'm Charlotte Christian, the founder of Summit, a divorce and custody law firm. We have so many questions from our clients about how do I get help with depression? How do I, maybe get with a counselor, get with a physician to help me through depression? And today we have with us Dr. Harrison Irons. Thank you so much for being with us, Dr. Irons.
Thank you for having me.
And you have a ketamine clinic, is that correct?
Yes, ma'am.
Tell us a little bit about what ketamine is.
Yeah. So ketamine is an anesthetic drug originally synthesized in the 70s for anesthetic purposes. And there were some studies that came out about 20, 30 years ago that showed when given in low-dose infusion forms, it can do a lot of good for people suffering with treatment-resistant mood disorders like depression.
So, depression seems to go along with divorce. Do you see that in your practice where divorce and depression actually go hand in hand?
Absolutely. We see a lot of people with depression, and depression it can be major depression. It could be specific to an incident in life, and divorce is a big one. We see a lot of depression that waxes and wanes with certain losses, divorce being a big one. Divorce is actually, if you look at functional MRIs of the brain, lights up the same parts of the brain as physical pain. It triggers the amygdala, which is responsible for fear and threat. And so people treat divorce as almost like physical pain, and also a physical threat. And so the use of ketamine has been really helpful to help patients going through those really isolated periods of grief like divorce, get over that and get back onto their lives.
So divorce really can then affect the brain and the nervous system.
Oh, absolutely. Divorce is one of the hardest things that people go through. And the brain neurobiologically recognizes that as our ancestors would, like an actual physical threat.
I've heard some people talking about ketamine, and they say that ketamine is just an anesthetic that sort of, puts people out, or something that you would use in anesthesia. Tell us about that, and is that true, or how can ketamine be used differently?
Ketamine has a lot of different uses. In anesthesia, we use it for more of an adjuvant to anesthesia. It's not a good solo agent to put someone to sleep, but it's good to add to an anesthetic. It's also used for sedation. A lot of times if people break a bone, particularly in kids, they'll use ketamine as the sedative to reset their bone because it has a lot of really unique properties in that it causes a dissociative analgesia, meaning that the pain is not perceived by the brain, it's kind of disconnected. It also preserves the respiratory drive, so it doesn't knock people out. If you were to sedate someone with, say, propofol, they would stop breathing, and it's a little bit more dangerous to use in the field or to reset bones in the ER. But when given in a weight-based, low-dose continuous infusion, we've found that ketamine does these remarkable things to the brain to help overcome just treatment-resistant depression, isolated, really specific deep depression in the way that it acts on the brain, which is very different than any kind of traditional antidepressants, which modulate typically your big neurotransmitters like serotonin, norepinephrine, sometimes dopamine. And ketamine will actually unlock part of the brain called the glutaminergic pathway. And glutamate is an excitatory neurotransmitter in the brain that more or less turns the brain on, opens up neural connections to healing called neurogenesis and synaptogenesis. So if someone's going through divorce and they're going through a lot of grief associated with that divorce, they'll get stuck in these ruminating thought processes, and they'll just kind of circle back and around, and they kind of takes them down that downward spiral deeper into their depression. Well, ketamine will unlock the brain, open up that glutamate pathway, get those neurotransmitters firing again so they can get out of that cycle and start branching back out, making new thought patterns and healing from that.
Is it addicting?
Ketamine is a Schedule III medication, and Schedule III medications also include medications we use for addiction like buprenorphine. So the DEA defines it as having a very, very low addiction potential. However, it's possible. Addiction is, possible with any kind of substance across the world in specific subsets.
So is it fast acting? Is it something that has to get in your system and takes a while to work up? Tell us about that.
Yeah, so with people who are more familiar with traditional antidepressants, you take a pill once a day, you see your doctor back in maybe 2 to 3 months and kind of assess what the change has been, which is kind of hard to do slowly but surely over 3 months to see how I feel now versus how I feel then. Ketamine is not a magic bullet, it's not a one-time fix-all, but it works kind of in the same thought, in that we do one infusion, typically twice a week for 3 weeks to really bring you up to a therapeutic range, really get those good brain changes occurring. And then as your mood starts to maybe slip back down, just a single booster infusion to get you back up to where you need to be to continue to feel better.
So tell our people what that process looks like. What does an infusion look like?
Yeah, absolutely. People are maybe familiar with IV hydration clinics. It's very similar, but in our clinic, Southern Ketamine and Wellness, everyone has a private room. And so before, of course, there's the entire intake process, making sure that you're a good candidate. All the paperwork's been filled, all the questions have been answered. But when you show up to the clinic that day, you get ushered into a private room. You get an IV started. The room is got a chair. It leans back. We hook you up to vital sign monitors. We try to really emulate more of a spa experience than like a medical hospital setting. And then you get an infusion of the ketamine into that IV over the course of about 40 minutes. And then afterwards, it's a bit of a slight recovery, kind of like anesthesia would be, since this medication does have anesthetic properties. And you would kind of come out of that and we'd usher you back to your car with your driver, and your driver would take you home for the day.
So when would be the next time that you would come in? What would be the schedule for having the treatments?
So initially, two a week really for 3 weeks. After the initial series of 6 infusions, we really kind of let the mind be its own barometer. You tell us when you feel like your mood is slipping back, you're starting to ruminate again, starting to kind of get stuck in those thought processes that you were in before you came to see us initially. And then we'd just do a single booster infusion to prolong the relief. And that booster infusion schedule is typically once every 3 to 4 months.
But your finding in the research shows that it really does help with grief or with loss.
Absolutely. It's not a fix for anything, but it's really a good place to accelerate that. It really gives you more of an opportunity to tackle that grief and that loss head on without feeling all the emotions connected to that. We use the dissociative properties of ketamine to really look at that decision, the whole thought process, what happened, and kind of detach yourself from it so you can process it without all the emotions being involved. And once you're able to process it, it's no longer unresolved grief, it's more resolved grief. And now you're able to kind of move past that event and get on with your life.
So it's more of a tool.
It's more of a tool, exactly.
Who would not be a good candidate?
There are contraindications to ketamine therapy. Some mood disorders like schizophrenia, bipolar type 1, type 2, uncontrolled mania, ongoing active substance abuse with medications that can really affect your hemodynamics like blood pressure and heart rate that make it unsafe. Recent heart attacks, strokes, a number of things, medical and mood disorders can be contraindicated in ketamine therapy. So we want to make sure that first and foremost we do a really accurate medical intake and screening to avoid any kind of contraindications.
What about ADHD? Is that a contraindication?
ADHD is not a contraindication. Medications sometimes used for ADHD can cause your heart rate and blood pressure to go up. And ketamine also has properties that can do the same thing. And so we monitor those patients very, very closely and will administer medications if needed to normalize their heart rate and blood pressure.
So you're double board certified in anesthesia and in pain management. Is that correct?
That's correct.
So you have other tools in your toolbox that can help people through grief and loss as well.
Absolutely. A lot of people will develop such deep-seated grief during the loss of a loved one or during the loss of their family dynamics with divorce, and they will develop PTSD. They'll start to ruminate and they'll see things around their house, or they'll smell things, and they'll trigger these really intense thoughts that can lead into PTSD. Another thing that we can do more on the pain management side is a stellate ganglion block. And sometimes people have heard of these things. There's a lot of data that came out with veterans with PTSD. And there's a bundle of nerves in the neck called the stellate ganglion. And we can do an injection of the bundle of nerves. And what it does is more or less reset the autonomic nervous system. So when, say, someone comes home and they smell their wife's perfume, they now divorced from it, kind of triggers all these feelings. They start to kind of go into that panic mode. That panic mode is ridden by your sympathetic nervous system, which gets your heart rate going, get your blood pressure going, get your respiratory rate up. So if you can reset that trigger for it through the stellate ganglion block, it's a really good adjuvant with ketamine for those who really have that more of that triggering PTSD type of response.
That's excellent. It's just amazing the research and the tools that you guys have to help people that used to not exist. It's exciting to see. But what is the healthiest way for people to think about ketamine in their healing process? So if they know they're depressed and they're trying to heal from that, if they're trying to get over a traumatic event or a loss or divorce, how should they think of ketamine in that process?
We always recommend ketamine as a tool more towards the end of the line of therapy. We always recommend, first things first, grief therapy, talk counseling, talk to your primary care physician, trial the regular medications, the SSRIs, the SNRIs, They're great medications, they're great tools. But if you've gone through the gamut of regular things, you've tried therapy, you've tried medications, and you're just really not getting better, ketamine is a good tool, but we always want that to be kind of towards the end of the spectrum of decisions. We never want to lead with that just because it's a big investment into your time and your well-being, and want to make sure that people really meet that more treatment-resistant picture before coming in for ketamine therapy.
Thank you so much. If you have depression, or you have, you've had a traumatic event, you're going through a divorce, or you've had loss, and you want to consider ketamine therapy, Dr. Irons has a ketamine therapy here in Birmingham, and I'm sure that we'll put up the ways that people can reach out to you and get more information.
Awesome. Thank you.
Thanks so much for being with us.